Good morning, everyone. I am Harsh Sharma, a program runner of the day from Merck Foundation. First of all, welcome to the Merck Foundation Health Media Training. So now I'm beginning the session to start. Let's watch the inspiring story of Jacqueline Munday, a victim of infertility stigma. Can we have the video, please?
Jacqueline Wende, a 27-year-old young woman from a rural place called Masii in Machakos County, Kenya, tells us her sad story of having both hands chopped off, not by thieves, but by her own husband, for failing to conceive, even though he was the one with a fertility problem.
Mandi ndio nilisikia akigonga mlango akiniambia Jackie nifungulie. Niliachana na chakula nilikuwa nakula, nikaamka nikaenda nikamfungulia. Kitambo nimfungulie ndio alinikata hii mkono. Nikaanguka hapo chini na akanifuruta nikaenda nikaanguka huko chini. Kitambo nianguka huko chini alikuwa ananikata kichwa na mikono na uso na akanidunga hapa na kisu na hiyo panga alikuwa nayo. Aliponichapa nilimuuliza, kwa nini ngila unanichapa? Utaniua peke yako. Akanyamaza akaniambia, leo ndio siku yako ya kuongea, hautaongea tena maishani.
Merck Foundation came to the aid of Jacqueline through More Than a Mother campaign. She was provided with a new home and a supermarket to enable her to earn a steady income and become independent. Like Jacqueline, there are many other women that suffer from infertility stigma. Merck Foundation works closely with partners to empower them to be heroines of More Than a Mother movement.
Infertility is not just a woman's thing. It takes the two of them to have a child. So many treatments could make it right. So join her. Together yenyan mona da chono be. Join her. Together yenyan mona da chono be.
Jacqueline, I want to know that you are my sister. As long as I exist in this world, on earth, my fate is connected to you.
Yes.
So you have to understand this. You come back to me in anything, I will always be there for you, and my room is there. So I'm coming.
Now I would like to introduce and announce Merck Foundation Awards. I would like to invite all the media. Thank you for joining in. And please, we have a Merck Foundation Awards and you can apply for that. Now I would like to present a short promo of Our Africa by Merck Foundation, a TV program conceptualized, directed by Senator Dr. Rasha Khalid. She's co-hosted the program as well.
Senator Dr. Rasha Khalid and creator of Our Africa TV show.
All Africa will be part of our show.
The CEO of Merck Foundation.
We want to support girls' education. No to infertility stigma. Yes to girls' education.
We want to stop gender-based violence, full stop.
Number of child marriage will double by 2050.
Welcome, Dr. David. The floor is yours.
Thank you very much. It's an honor to give me this opportunity to talk to you once again. I thank Merck Foundation. Thank you, Merck Foundation. Thank you, Dr. Rasha College and the team. Starting my topic, which says infertility prevention, the link between infertility and infectious diseases and male infertility. Dear viewers, dear media group, we would like to take this opportunity to highlight more about infertility prevention, the link between infertility and infectious diseases and male infertility. And through this, we are breaking the stigma around infertility in Africa. So for sure, infertility is an issue here in our setting, especially in Africa. But usually the policymakers, many people, the policymakers have not really stood to help us fight this issue of infertility. But when you visit within our hospitals, where you are in your country, you can really see how many infertile couples are seeking treatment. So I urge you, dear media group, to always take time and visit one of the hospitals which are managing infertility in your respective countries and see how many mothers, how many couples are really, listen to them, because now we are calling upon, thank you, Merck Foundation, because we are now identifying this group of people who are becoming vulnerable. And when it comes to Africa, you know that in Africa, we have a big role to play as media group to help our societies. You know that in our society, this infertility issue, it brings about psychological stress, marital conflict, stigma, domestic violence, encourages factors, sexual behavior, and divorce. You all know this, the media group, that our societies really find these families who are faced with infertility, as we show in the previous videos, they have a lot to stress, domestic violence. We saw that woman who has been chopped off by her arm. So all of these, they are there, but who should show these that are there? It's you, the help of our media group, please, to help us identify these vulnerable mothers, families, and to be off. So that's why Merck Foundation is helping us to really fight this issue of infertility prevention in our society, especially in Africa. You know, in Africa, that's why we embark on, you know that many of our patients in Africa, they believe in witchcraft. If a woman, if a couple has not been having children, they may think it is a witchcraft. They may think that it is spiritual forces. Traditionally, what I'm talking about, you understand it from the home point of view. You get me. They may say it's spiritual forces, witchcraft. Maybe we didn't adhere to cultural taboos. Others who are religious, they say it's God's will. Others, they say it's paternal compatibility, abortions. You know, because, you know, in our setting in Africa, people in regards to knowledge, education is very low. So they will all think that there's something attached, and they, you know, they become vulnerable, as we saw in our society, and we see it. So we have the infertility awareness and prevention. As media group, please, we want to encourage you to start raising awareness. And awareness is, you can raise awareness through visiting your clinical setting, hospitals, work alongside with doctors, and try to show that men too, no stigma to infertility. Let's not say that men are only women are the only infertile. So it's better as media group to show our community that women are more than mothers, encourage them, and even men are more than fathers, because also men who are not have not had children, they are always felt small. But we should also show the community as media group that really these people matter and they are more than being fathers and mothers. Of course, I continue to say infertility is not a stigma. And as media group, we should always really emphasize that. And you saw in Africa, some traditional culture and religious practices combined with low resource environment are linked with higher levels of preventable causes of infertility in women. You know, as I told you, infertility is really an expensive treatment in our setting. So because in Africa, really, we are now struggling to develop, and most of the families, are struggling to raise that amount of money to go for having such a treatment of infertility. So that's why, as our media group, even doctors over there, it's the media group to really see that we rather prevent these causes other than let it happen and these couples are just struggling to have treatment in that field. So you find that in our environment we have poor nutrition. We can have poor nutrition, untreated sexual transmitted infection, unsafe abortion, consequence of infection caused by practice of female genital mutilation, exposure to smoking, lead, petrol, and other environment. So when it comes to nutrition, please, it's as a media group, let's show our community that nutrition can bring about infertility. And with infertility, it has been proven that if really you're not having good feeding, your hormones will not be enough to lead you to really have babies. So when you're not feeding well, you can have an ovulation, you will not ovulate, your ovaries will not work. When we're seeing poor nutrition, it's not about like you're not getting what to eat, but also people eat badly. That they eat foods that can increase their weight. So once you're overweight, it may bring about infertility by not ovulating. And also if you're too small, or if your weight is BMI is low, let's show them that once your BMI is low, you also not ovulate. So that's why nutrition comes to play a big role. So dear media group, let's try to emphasize our community that should you be underweight, you're likely not to ovulate. Overweight, you not have ovulation, and also you not have your normal period. When you look at untreated sexually transmitted infection, I can tell you that 85% of the causes, 85% of the causes of infertility is a tuberculosis infection. So let's help, because now, like in our settings, sub-Saharan Africa, we have this infection which can bring about this kind of tubal blockage and not consuming. So as media group, please, we can sensitize our community such that we avoid sexual transmitted infection and our tubes will be free. Unsafe abortion. Unsafe abortion will bring about your tubes getting blocked due to infection. So as media group, really, we need to see that we sensitize and show them that doing an unsafe abortion will lead to your infection in the uterus and infection to your tubes. So like now, also in Africa, where there are some communities that bring about genital mutilation. This all about female genital mutilation will bring about infection. How is it done in any safe way? Bring about the same infection. From the infection comes from the vagina up to the way to the uterus. So this kind of thing prevents about your tube becomes infected. So we also have exposure to smoking. Like now we are turning to developing situation. We find that many young adults are smoking, taking drugs. We are having coping up with development. We have to understand that once these couples, we have to take history and show them that overexposing to lead petrol, other environment factor pollutions can bring about that. So we have, as clinician, we do take history and advise couples. But as media, you can play a big role because, you know, in Africa, one doctor can attend to many patients. So we are overloaded. So better that the media group, thanks to a Merck Foundation, that really you're training the media group, because once you prevent, we shall have few patients coming to us, and really everything will be fine. I said previously that in sub-Saharan Africa, infection is the cause of infertility. Up to 85% of women seeking infertility care, compared to 33% worldwide. I can tell you, listeners, in our daily consultation, we are finding challenges with tubal infection, because find that people are having infection, people are sexually active, and being sexually active and these behaviors, we should show that really they should mind about their tubes getting blocked, and that treatment of IVF once tubes are blocked, it is so expensive. So we should go ahead and really sensitize our communities. So we should really emphasize and show them that they should have regular checkups and really prevent being silent with once they get infection from their genital area. They should not take it for granted. They should know that they could be consequences in future. Health facts like chlamydia, gonorrhea. We should, you know, chlamydia is an infectious disease, and gonorrhea. And these ones are really sexually transmitted infection, and they are very dangerous. So our dear colleagues, the media, colleagues in terms of fighting against infertility, let us work as a group. Let's work alongside you. If I'm my doctor, I have my clinic, please endeavor to visit even others. If you have your gynecology doctors around, please endeavor to sensitize our community that is chlamydia and gonorrhea, which are impacting in your reproductive health in the future. We have HIV. HIV, besides the negative impact that HIV has on your body immunity, systematic illness, weight loss, stress, etc., pelvic inflammatory disease, HIV can also affect your body's ability to produce hormones prior to fall pregnant in irregular menstruation and ovulation. For sure, in this slide, as a media group, we should educate our community that let us prevent HIV, because once you are HIV positive, you are likely that the medication you are on and your body's reactivity, especially to tell the community that once you're HIV positive, the situation you're undergoing through, the medication and the stress is going to impact on your hormonal production. And also this medication affects the way the tubes function. So really, this is a very important step that we should educate our adults and the community that let us prevent HIV. It can also contribute to your reproductive health outcome. Yes, please. Infertility affects men and women equally. That's a slogan that we should keep on saying to our community. Practice safe sex education. Don't adhere needles. So please, this is the image that shows that really we can really show these images in our clinic, in our newspaper, and show that really we care about infertility. Both women and women should practice safe sex and avoid risky behavior, especially as I said, in Africa we have a lot of infectious microbes because our weather favors so many microbes. So if really sex is not done in a clean way, in an unsafe way, let's inform our community that it can bring about, it has impact on infection. Infection comes from the genital area, it goes away directly to the tubes until it reaches the ovaries, and this infection spreads everywhere. Both men and women should practice safe sex, I said, and sexually transmitted diseases can cause serious complications, including pelvic inflammatory disease. Pelvic inflammatory disease for the media group is infection that starts away from the vagina to the womb, which is the uterus, to the tubes, and it eats away the tubes, and eventually the sperm will not pass through those tubes to fertilize the egg, as I said, and this tube will be blocked, hence causing infertility. And thereby, we shall tell you, you have to do IVF, and IVF really in Africa is very expensive, and these couples will just go away depressed, and in the end, it will bring about divorce and divorcement. I tell you, in our community in Africa, they'll say, let me divorce, I'll go and get another partner. But I always tell them in my consultation that the impact of divorce is more expensive than the treatment of HIV, because divorce, they may seem it is really easy, but also when a man divorces to go and get a child or marry, or a woman go marry, that impact may seem expensive than undergoing treatment of IVF, though prevention in Africa is more important because we need a lot of, we are still developing, and the family needs to develop. For women, a number of strategies may help increase the chances of becoming pregnant. So you can see this image, which we as media group and doctors, we can always put teaching around to show that exercise, now that we have a young generation, and our young generation are coping up with the Western culture. So we need to come up to tell people that overweight, we are having like now young generation who are having overweight due to eating habits. So, and there are some cultures who think that being big, if you are going to have marriage, they feed their daughters so that they can have big size. So I see them in the consultation. Those cultures that feed their women before they get married, and they become so fat, and in the end they like spend a year, 2 years without having babies. It's better as a media group to show that once you're overweight, you have a lot of hormones with you. So better exercise helps reduce a lot of hormones and metabolism for your body to have ovulation. So I tell you as a media group that once a woman is having a BMI that is high, overweight, it makes that woman not ovulate. And when you don't ovulate, you don't produce eggs. And when you don't have eggs, you will not get pregnant. So let us inform our community that overweight brings about an ovulation, not produce eggs. So let us educate our community that they should do some exercises. And also, there's minimal group of people also who do a lot of exercise. If you lose a lot of weight and your BMI, your weight is it is small, you also not ovulate, because we need a weight that can help you ovulate. Eat a balanced diet and maintain a healthy weight. Yeah, we said about this. We should encourage our community to really have a balanced diet and maintain a good weight to have, pregnancy. Being underweight or overweight can affect your hormonal production and result disturbance in your monthly period. Yeah, it's really maybe, some people lack information. We may be there, but for us who are in the hospital settings, my dear, I tell you, we get people who are overweight and they are struggling to conceive. And what we tell them, but please reduce your weight. And even, there are we've seen some other herbs or some people selling drugs that can make you lose weight. Yeah, we see mothers who have gone to some where they sell drugs and they give them drugs to reduce weight, but getting them informed, it can show them that it can bring about your hormonal balance and you get pregnancy. Of course, we've seen that smoking, we should tell our young adults and the community that over smoking, would you want to become like reproductive, in terms of reproductive health in future, be well, please quit smoking. So this, we should encourage our community like this, because you find that our society now, we have a new generation that really, our young adults are smoking, taking drugs. So I think they are lacking this information that they will have impact in the near future. So dear the media group, let us sensitize our community in regard to this topic. Because as I told you, once you have infertile couple, though very rare to have developments once they are not having children, because having child is a right. So you find that a family is not developing, planning more development because they are not having children, especially in Africa. Children are very important. Limit caffeine. We may try to get pregnant, may want caffeine, we may try to get pregnant, may want to limit caffeine intake. Ask your doctor for guidance and safe use of caffeine. I tell you, caffeine, we should also study that, show them, community, that caffeine, it can bring about infertility, and also once you conceive, you can have preeclampsia, as this caffeine can limit blood supply to your womb. You know, taking caffeine can, when you're pregnant, also can bring about limiting your blood supply to your baby. Avoid industrial and environmental toxin. Yeah, you know, we are having now developments. Cars are coming up, lifestyle. So let us inform our society that really these pesticides, you know now even that those people in the rural areas are now using pesticide to spray their crops, fertility, like they want to get more production from their agricultural products, other selling other chemical products. So as the government is coming up in our setting in Africa, we are using this environment, we are facing this environment toxins. Please, let us show, studies have shown that these industrial toxins are impacting on our fertility outcome. Avoid or reduce stress. Yeah, this stress really affects a lot in regard to infertility. So we should also raise awareness about male infertility, because now we are facing really, I urge you to visit clinical settings and find out in your nearby your home area how many men are coming with infertility. This issue is coming up really, they are around, and really it also affects them. So it's better to raise that men can also have infertility and we can treat them. You know, long time ago, I think even not even a long time, when you go to our rural settings, you can find that a man marries, and after like 1 year, the woman is not having children. He decides to go and look for another one, like that, until when he sees that the other one he divorced has had a child. That's when he thinks, oh, it may be me. So we don't want that kind of divorce and that family conflict. Please, let us encourage that once a woman sees that he's not having a baby, let us also raise awareness about the male. They come because we've done things that minor medication and even dealing with simple IUI, and we see that men are conceiving really and reducing family conflict and marital conflicts on a daily basis. Men are core to reproduction. Men can be a core to infertility problem. Yeah, I said this because please let us make awareness. Thanks to Merck Foundation that really you are encouraging us, impacting us, but really I tell you, men have play a big role in regard to reproductive outcome, infertility, and when they join in hand with the family, the couple, really they get treated and the family goes on, hence development and the community and country at large. Share the treatment journey together. Yeah, these are good images to show in our daily practice. Being it at workplace, we can display these images. Being our social media, please, media group, being on what Instagram, WhatsApp, let us use these platforms to inform our society. Infertility does not just affect women. About half of the causes of infertility too include male factor. Infertility is one of the commonest conditions affecting product age group. Yeah, this is true. I've said about this. Actually, infertility, not until you raise awareness that you know that these people exist. These people always have depression. They don't want to show in the group, but once you raise awareness, my dear, you will feel where to see them. In my city, in my country, we used to have like people coming from outside, from Western, coming to treat infertility. And my friend, I can assure you, you can see the whole like area is people coming from all corners to come for treatment, and really that it's really a problem. Really, these people really are there. So let us involve men, because in our society, men are the head of the family. So please, let's make awareness and we get these men come out and tested and get treatment, because in this current situation, as the development is coming, modernization, also infertility, it should not be left behind, because it's a cornerstone of development of a community. You can see this picture of this happy family. You see, I always see in my clinic, a woman comes crying, alone, crying. But when I announce that, oh, you're pregnant, that's when the man comes happy, accompanying her. Please, just encourage them to come from the beginning in the consultation, because this affects both men and women. You know, the way infertility affects men is that it can be anatomical, psychological, and it can affect either sperm production. The problem of men not having to produce is either from the sperm that are not enough, or they are not produced, or we can be environment that is affecting them, though they are there, but they can be affected by the environment, stress, radiation, and they become inactive. You know, in our society, they think that every man, like just ejaculate. Sperm is not about the ejaculate. It's not about the fruit you see. Inside there's a normal sperms that can impact on, or either environment can have impact, or it can be from the environment. So when they come, we try to, or from a diet, when they come, we try to teach them. Also, they can, you know, once the media group and in this community, they will start to look around what is causing, you know, and it really, it works, I've seen. For men, the combination of keeping healthy and avoiding environment toxin may help. Yeah, of course, once the media group, or we sensitize through our social media, someone will start to look around himself to see, what am I doing that is not impacting on the outcome of my reproductive health. Yeah, we say this, that we can all use such images to show in our setting and even community. Limiting alcohol, avoiding drugs, stop smoking, all these simple things can be done, and we can see that really not only will bring about, by the way, about fertility outcome, but also these kind of behaviors for our new generation will bring about development. Avoid high temperature, and this can affect sperm production and motility. Yeah, you know, these days we have a lot of, in a town everywhere, that you have steam baths. You have a lot of steam baths. You know, people now are getting like overweight, and the only thing they say, I'll go into steam bath to reduce my weight. You go in steam bath when you're still young. Let's know that a lot of heat can impact on the genital areas of a man. That's why the many genital areas are outside, because God created them to be outside, to have a good temperature. So when you make stillbirth, you're heating your testicles and it will impact on your sperm production. Our society should know that, because really, once they know that, they should avoid, our community, how it is. Sitting on like a motorbike here, also, because the motorbike has a lot of heat. They should know that really it impacts, and though they sit there, but they should try to mind about it and have some time to reduce that kind of heat. Next, please. Exercise regularly, avoid exposure to astrotoxin. All this really, I said previously, eat balanced diet and maintain healthy diet, obesity. Yeah, let us use this in our daily practice to show our community, like in a newspaper, social media. Please, let's become an advocate of this community. Key take-home messages. Infertility is not a stigma. Infertility affects men and women equally. Get informed. This is our role to inform our society. Support your wife as men. Infertility is a shared responsibility. It takes, yes, break stigma around infertility in Africa. So what I want to finalize with you, because I talked about infection in our setting. Infection in our setting in Africa is a leading cause of infertility. Infection starts with what I was telling you, that there's what we call pelvic inflammatory disease. What do we mean by pelvic inflammatory disease? You as a media group, you see this image. Supposing this is a vagina, if you have unsafe sex, the vagina, the infection will come from the vagina way up to the cervix, womb, and the tubes. For a woman to get pregnant, it's not about, by the way, sometimes I talk to my patient, they come telling me that when you have sex, all sperms get out. It's not about that water that makes a baby. Inside that water, there's live sperm, what we call spermatozoa. They have to move from the vagina up to the womb, tubes, and they go to the ovary. They meet the egg. So not all the water comes. Sometimes men may ejaculate, and inside that ejaculation water freeze, there's no sperm. But many, they think that after ejaculating, there must be sperm. No, sometimes it can be empty, because that doesn't mean that water, that ejaculate has sperm. No, the people, our community, they know that ejaculate should also go. And also we have some other, we should inform, there are some health professionals who bring this ejaculate sperm and they want to inject it directly. It's a very toxin, because you know that sperm ejaculate has a lot of dirt. It has a lot of cells that are not supposed to go to the woman's body. There are some health professionals who get their sperm and they inject it directly without doing IUI. This is very unprofessional and can lead even to more infertility, to tubal blockage. So once these tubes are blocked in the African setting because of infection, this young lady will not have children through natural ways. You find that we shall tell them to go for IVF, and IVF is very costly in Africa, because Africa, we are still developing and we need a lot to cover besides covering the IVF costs. So please, let us inform our community. Get simple diagrams like this one. Inform that for a woman, young adult, protect your tubes, protect your tube from infection, get it blocked. And should you have vaginal infection, itching from down, please rush for treatment before that infection goes to your tube. Some young adults, they think it is normal to have vaginal discharge because of our community. No, it's not good to have vaginal discharge. And it's not good for a woman to have such a funny smell. No, please get it. Let them know that if you have some kind of itching vaginal discharge, rush to the doctor, not traditional healer, but a doctor. Treat you before your infection goes up, especially too. And don't go just buy any other medication before you see, okay, before you get treated. But please, let us also avoid unsafe abortion. You know, once you do unsafe abortion, they will insert some materials that are not sterile into your womb, and they will damage you. And in the end, you have infection in your womb, and in the end, you will not produce. You understand? So it's the role of our media group, our doctors, use the social platform around to show that the health of these young adults, young women are important towards the reproduction period, so that they can protect. You know, most people fear pregnancy. Most of the adolescents, they fear pregnancy than infection. Yet, this kind of, and when they get pregnant, they fear told they are coming that they are pregnant and they go to do unsafe abortion, and their private, these reproductive organs will be affected, and the end, it will impact on their product outcome. Also, I told you, once you have a lot of weight, your ovaries will not make good eggs, they will not make eggs. And once you have also less weight, you will not have ovulation. But what we are seeing nowadays, people are getting overweight and their ovaries are shutting down because their ovaries are becoming with a lot of fats and they cannot produce enough eggs for reproduction. So thank you very much for listening to me. Thank you, Mike Foundation.
Thank you
Thank you
so
so
much,
much.
Dr. David. And now we
Welcome.
would like to hear from Dr. Francisca Shitenge Walia. I would like to invite.
Greetings, everyone. Glad to be on this platform today, speaking about an issue which I think is important and critical, especially for us here in Africa. And I'd love to thank the Merck Foundation for being deliberate to prioritize this conversation around infertility. Thank you, Dr. David, for emphasizing that infertility is not just amongst women, but men as well. My focus today will be very specific, and I'll try to bring out the social and psychological impact of infertility. I believe Dr. David has done a good job bringing out the risk factors, the causative factors, so I will not dwell much on that. Though, allow me to bring out a certain definition which I feel is also important, that I think as a media team, you need to appreciate. So when we talk about infertility, there's the primary and secondary infertility. And the difference is that a primary infertility is when a pregnancy has never been achieved before. But interestingly, we've started seeing a number of women, I don't know what maybe are the statistics in your various countries, but some women now would have achieved maybe a pregnancy before, but they're not able to reproduce again. So that's also an important aspect or presentation that is now presenting itself. So we want to be deliberate to speak to these various aspects of infertility, starting from prevention, diagnosis, and treatment. Just to throw some statistics, infertility affects about 186 million people worldwide, and a significant percentage of those individuals are actually in sub-Saharan Africa. Hence the need for us to be deliberate to give this area attention. And unfortunately, infertility care is a challenge in sub-Saharan Africa, especially in general in low and middle income countries. It hasn't been prioritized. And actually, a number of even insurance companies will not cover a big aspect of these infertility presentations. So how do people get help? How do people get support? How do we improve access for these women and men who need fertility care? And I think this is where the media, you come in strongly to build representation, to build demand around infertility or fertility care needs, so that you can guide policy through your advocacy and lobbying. This image is just showing primary infertility in women. And if you look, is that, so the darker regions have got a higher level of infertility, right, compared to the lighter regions. So in general, you hear conversations, I don't know, in Africa, people are very fertile. There's low infertility, but when we look at this diagram, of course, there may be a newer diagram because this diagram was done in 2010. I couldn't find an earlier resource. One thing that we'll be able to appreciate there from this diagram is that Africa is quite darkly shaded compared to other parts of the globe, of course, with exception of certain aspects of Asia. So again, it's speaking to the prevalence of infertility, and this is primary infertility. So it just indicates that there's actually a need, there's actually a burden in Africa. So why is infertility important? Why are we talking about infertility? I just want to reiterate some of these points. One, fertility is encompassed in good health, right? We're always talking about it's a right of every human being to have access to health, to have good health. So yes, so meaning even fertility is the right of every human being, and hence it should be given the attention that it deserves. And even just from the opening video that we saw, we see that infertility has got the potential to bring inequalities, especially for women, right? Especially in our African culture, where a lot of infertility will be blamed to a woman, bringing about a number of gender inequalities. Then there's also just the general negative social impact that infertility has potential to cause. In our opening video, we saw an example of a woman who was physically abused, emotionally abused because of her fertility presentation, right? So it can lead to violence, stigma, disruptions of homes, families through divorces, and various mental health conditions, mood disorders, depression, as anxiety disorders, as people struggle with this presentation. So when we speak of gender-based violence, also keeping in mind the high rates of infertility and knowing that infertility leads to a significant amount of violence amongst women in the various homes and in society or just community in general. It is important to integrate conversations around fertility in the gender-based violence conversations, right? Because gender-based violence conversations have at least had a good milestone and support. So how do we integrate conversation of infertility in these gender-based violence conversations as well? Because 1 in 3 women experience gender-based violence. And unfortunately, a lot of times when people think of gender-based violence, the first thought will go to physical harm or sexual harm, right? When we talk of sexual harm, a lot of times it will be rape or sexual violence. But what about child marriages, especially in our African culture? What are we defining as child marriage? Are we accepting that it's okay, or are we standing up against those? Because we'll speak shortly about child marriages and have an appreciation of how these can also lead to infertility issues. When we talk of physical harm, a lot of people will think of physical punishment or just domestic violence. What about genital mutilation. Are we speaking about these issues that are happening in our communities, in our societies? Mental harm, right? Verbal abuse, emotional abuse, which have got long-term consequences on individuals who are exposed to this abuse and increasing their risk of mental health disorders or conditions. Another important aspect is economic harm or manipulation. So we're going to take another step and talk a bit more about child marriage. Child marriage is common in East and Southern Africa. 27% of women in East and Southern Africa have given birth by the age of 18 years. Right? So what does that mean for these women when it comes to productivity in general, education? Child marriage brings a number of issues, right? There's the violation of the girl's right, because she's got a right to education, she's got a right to good care. But when she gets pregnant early, before she can mature, what does her life look like? What does the rest of her life look like? Actually, it's good that now we are being very deliberate to encourage continuation of education even after a girl has gotten pregnant early. But in a situation of a child marriage, is that practical, right? There's increased health risks of these women and girls, increased vulnerability to domestic violence. It limits their achievement in general, and they're at increased risk of sexual violence, risk pregnancies, infections, as Dr. David was mentioning, through these sexual violence, risky pregnancies, infections, or sometimes they even want to abort those pregnancies. They increase the risk of infertility in these women. So then you find years after, when they want to get married, they now want to settle down, they're having issues with their fertility. So it becomes a compounded issue or problem. We'll also speak about another issue which I think is common in a certain aspect of sub-Saharan Africa, especially East Africa, which is female genital mutilation. And strangely, I don't think we speak enough about it. And this is the practice of removing external female genitalia or injury to the female genitalia or organs for reasons that are not medical, but usually just for cultural reasons. As much as we respect culture, and culture has got a role to play in our lives as Africans, but what cultural practices are beneficial and which ones are harmful? It is estimated that about 200 million women alive have experienced female genital mutilation, quite a significant number. And it is predicted that another 68 million girls will experience this ordeal by 2030. So how do we prevent this estimated number? I think the media, you've got a great role to play in this. So this again is just another image that is highlighting the high levels of female genital mutilation, with a focus, as we can see, in East and West Africa. We've spoken about these various aspects: infertility, gender-based violence, child marriages, and female genital mutilation. How do these impact women? Firstly, let's narrow down to infertility. Especially in Africa, one thing that we can appreciate is that fertility is associated to an individual's identity. It's part of our culture. So meaning, because it's associated to one's identity, it has got potential to cause significant social and psychological stress. I'm sure it's something that we commonly live with, where when an individual just reaches a certain age, culturally, people are already asking, hey, when are you getting married? When are you having children? When people just get married, just a month, 2 months down the line, people are already asking, where are the children? We want cries in the home. And those can be areas of significant stress to individuals. And unfortunately, for the longest time, a lot of that burden has been placed on women, and women to be the cause of infertility in the home. But today, even as we're discussing earlier on through Dr. David, we're appreciating that no, there's a 50-50 chance of the cause of infertility, either in males or females. And hence there's need to have a holistic approach to the presentation of infertility. So as a media house, how do you communicate this to the public? How do we bring this information and knowledge to the public, to educate the public, so that we reduce stigma around infertility? Because this stigma causes a significant social and psychological stress on these individuals who are going through the infertility journey. And in Africa, I think what makes it even complicated is I think it is not part of our culture for one to have a child-free status, right? Where one can just say, oh, no, I just don't want to have children. That's why I'm not having children, like the Western side. Because in the Western side, someone can just say, no, I've just chosen not to have children. But in our African culture, fertility, reproduction has been greatly linked to one's identity. And it's like it's an expectation. So it even makes it difficult for women, men, or couples to actually say that maybe they just don't want to have children, right? So it's the social and psychological distress is very, very, very high in our African settings. And hence there's need for us to give attention to this area to see how can these individuals be supported? How can community come in to make this journey of individuals who are seeking fertility care to be less stressful? Because unfortunately, society behaves different towards these individuals, hence compounding their distress, which they're first already experiencing at an individual level. We'll find tendencies where such individuals maybe are not invited to certain family parties or gathering when maybe it's a birthday for a child, or you'll find people start hiding that they're pregnant from these individuals, or others may even pass very insensitive comments about infertility to these individuals. So how do we educate the community to be sensitive to individuals who are experiencing infertility? So you find that these individuals are significantly stressed, their self-esteem goes down, they start feeling like a failure. But we've been having these discussions, and we're appreciating that being a woman is more than being a mother, is more than just having a child, right? Being a woman is more than just being a mother. Being a man is more than just being a father. And being a father is not only about giving birth biologically to a child. How can we normalize these conversations? Because you find that for a lot of these individuals, a lot of anger will build up. They'll have a lot of negative emotions because they would have tried probably different avenues of support or treatment to help them through this journey. And maybe they might have a number of failed attempts, or the services are quite costly, which adds to the frustration of these individuals. And of course, this can lead to depression, can lead to anxiety, loneliness, right? So another key aspect is how do we reach out to individuals who are going through this journey so that they get the help and support that they need through this journey for their mental well-being, so that we can allow them to still thrive, to still be happy, productive individuals of community, despite them facing this journey of infertility or getting fertility care, which can be a stressful journey. So then when it comes to the young girls and child marriages, these individuals are immature, they're still young, but then we have to add another responsibility of them taking care of a minor, being a wife, being a mother. That can cause so much stress on them. And as we mentioned, stress affects their fertility. And we see this vicious cycle going on. And of course, the issues of early pregnancies, HIV, and other STI infections, because they're at risk because of early exposure. So how do we reduce these aspects? What role does media have? So media, you're a very, very cardinal part of the puzzle or solution when it comes to various infertility issues. Because of course, infertility, it's quite a complex issue and presentation, and it's got a high influence of social culture, the social culture aspect or context in an area or in a place, right? So how, as media, can you speak into that space? Because one great thing that we can appreciate is that media has a great influence on the social cultural aspect of any country or place nowadays globally. So how are you using this voice, this privilege, this potential that you have? An important aspect that you could facilitate is creating awareness, right, around infertility. Because a lot of the stigma that comes from infertility is because a lack of understanding of what causes infertility and contributing factors to it, presentations of infertility. So let us educate the public so that as people are more educated or aware about those issues, people will be more sensitive to individuals who are presenting with fertility issues, and there will be reduced stigma for those also individuals who are experiencing some form of infertility. Another key aspect, how do we guide on the services available, right? Because there are a lot of people who are not even aware that they can actually seek help for their infertility presentation. Gather resources of where there are fertility care clinics or obstetricians and gynecologists who can support these women and men or urologists within your country or areas, so that people can actually get help and support for their journey. And for a number of people, if early identified and get early treatment and support, especially as a team or a couple, chances of fertility are high through professional guidance or support. As media, we've got a great voice, we've got a great platform. Advocacy for infertility care treatment or inclusion into insurance policies, improved investment, infrastructure, human resource to support this cause, giving platforms to advocates to speak on this topic on your various platforms, those can indeed go a very, very long way. How do you create a platform for lobbying for investment, right? Or changes in health policies around fertility care? And I think a great platform that we already have in Africa is maternity care, child and maternal care. I think a lot of investment is being done in child and maternal care. But interestingly, the focus is only on when the woman is already pregnant and when the woman has to give birth. What about facilitating and supporting these women couples to actually get pregnant in a healthy way, in a healthy manner. So there's actually a lot of room and platform to ride on to improve this area. What are some of the areas that, as media, you could consider, right? How can you be solution oriented? And I know as media houses or media personnel, you are very creative. How do we put our minds together and come up with creative ideas or solutions on how to tackle this issue? And also another important key aspect is a lot of people also have wrong information around infertility or how to get infertility care or where to get it. So another important resource is get the specialists, get the doctors, the nurses working in these spaces, give them a platform to speak, to educate the public on those issues, right? Do your research well. Let the sources of your information be accurate, evidence-based, and you can achieve that or facilitate your work by actually speaking with professionals in this space on your various platforms. So again, a good example that I like to share, which is this picture or image, and why I feel how you share this information is also important or key to how the public will receive it. So for a topic like infertility, what title or theme do you want to give your conversation? Is it adding to the stigma or reducing from the stigma, right? What angle do you want to touch around this topic so that you make sure that you strongly deliver on that area to the public? And that information should be broken down in a simple way that majority of the public can actually appreciate and understand. If possible, even include terminologies or terms that are used in your culture or in your space of practice in community to refer to this presentation. And I know sometimes as media, we want to catch people's attention, and make maybe your title or topic catchy. But in all that, we have to be careful that as we do that, it shouldn't be adding to the stigma. It should be in a way that it promotes sympathy, understanding around infertility. So I'll give an example like this image here on the screen. When you look at this image, how does it make you feel? What vibes is it giving? Is it giving positive vibes? Or is it giving negative vibes? Do you feel this will improve stigma or add to the stigma? Right? It's things that may seem subtle, but have a psychological impact on individuals' uptake or perception. And when you look at this, it's dark, it looks dark, negative. So instead of improving people's perception on infertility, as much as you are trying to make it catchy, it still brings out a negative connotation. And you media personnel are experts at understanding your public, your crowd, your catchment area or space of where you're communicating what you're communicating. So it's important to appreciate that and skew your communication, whether it's by image, whether it's through conversation, whether it's written, in a way that it's still attractive, but it's still positive, it's solution oriented, and it's reducing stigma or negative perception around infertility. So allow me to just maybe narrow down a bit on the solution oriented aspect. On our media platform, let's guide people to places, solutions, resources where they can get help, where they can get support. because a lot of people do not know that they can get help and support for their journey, or they don't even know where to start or go to. So could we share that information with the public, link them to those places? It can even be on social media. Link them to certain houses or a place where they can reach out or call to be guided to where they can receive support. Provide discussion forums around infertility. Even better if you can find individuals who have walked that journey and they've been successful, or how they've had to pull through, or the negative impact that it had on them, on how community or family reacted to them. And through those shared stories, another person out there can be encouraged. Refer to experts to give information that is needed, right? Very helpful as well, so that the information can be accurate, can be scientific, evidence-based, so that the public can trust the major house even as they share such sensitive information. Oh, that's the last slide. Thank you. Yeah, so media personnel, you are a great part of the solution. You are a great part of the solution. Create platforms, network amongst yourselves, right? Invest in yourselves. How can you bring out this conversation in a positive way? You're the experts, right? Because a lot of individuals, especially women, are experiencing a lot of social and psychological distress because of infertility. And they're isolating themselves. Then they find themselves with mental health disorders, especially depression and anxiety. They become less productive. And this is actually not only women, but men as well, right? How do we encourage that this is a couple issue, it's a couple conversation, so that they go together for care and support? For your attention.
Thank you, Dr. Dr. Francisca. And now we'll take a short visual break with our Merck Foundation animation film. We have a sugar-free Jude.
Merck Foundation. No more diabetes. Reverse diabetes. Goodbye diabetes.
It's morning rush time to school, and Jude is about to take a big bite into his breakfast on the go. Jude loves donuts, especially sugar-coated ones.
I love the taste of sugar on my donuts. It makes my morning sweet with this juice combination.
Jude, don't you think your eating habits are too unhealthy? I am worried about the rate at which you consume sugar products.
James, relax. I can't wait to eat my lunch. More donuts? There's nothing to worry about.
Jude was not bothered about James' concern. He went on eating more sweet foods day after day. As the days passed by, Jude started noticing something quite unusual.
My goodness, not again.
Jude would wake up several times at night to wee-wee. It was so uncomfortable. Not only that, but he also noticed that he would wake up very thirsty. Jude would need to drink water multiple times during the day as well as night, and this also meant using the washroom several times.
Oh my God, this is so destructive and shameful.
What is it? This appears to be the third time you woke up to use the bathroom. You even look a bit fat. Very unusual.
I have no idea, Mom. And I've been feeling very thirsty lately as well. And sometimes tired.
We need to see the doctor to make sure all is well with you.
I agree, Mom. It disrupts my day at school too much.
At the clinic, Dr. Yobo decides to conduct a few tests to confirm his diagnosis about Jude. He opts to do the blood glucose test to check Jude's blood sugar level.
So, according to the results, you have type 2 diabetes.
Type 2 what?
Diabetes is a condition wherein the blood sugar level in your body becomes too high. In type 2 diabetes, there is insulin resistance or relative deficiency of insulin that results in excessive blood sugar, which in turn can lead to other health problems. In short, type 2 diabetes is a metabolic condition in which the body's insulin is either ineffective or relatively insufficient to deal with the blood glucose levels.
Dr. Yobo continued to explain to Jude about his condition.
The exact cause of diabetes is not known, but genetics, family history of diabetes, and an unhealthy lifestyle seem to be the most common and important causative factors.
What happens if diabetes is not well controlled?
The long-term complications of diabetes can include the following: stroke, blindness, heart disease, kidney failure, sexual dysfunction, and amputation. Type 2 diabetes is a chronic condition in which there is bodily resistance to the insulin produced by the pancreas, and it typically manifests in adolescents. Managing this will require medication and regular blood sugar tests as well as a healthy lifestyle.
It was tough to accept for Jude at the beginning,
But days of sugar-coated donuts and sweetened drinks are over.
but he had support for his new lifestyle. The school made sure his lunch was not full of the usual sweet things, and his friends reminded him to take his sugar test and play football or basketball with them regularly to keep healthy. His parents were also supportive, preparing healthy meals for him and removing all sweet and sugary drinks from the house. In fact, all family members became sugar-free too. Back in school, Jude and his friends soon formed a Sugar Police Kids Club to raise awareness about the condition and to help others who had diabetes or were pre-diabetic so they can prevent and early diagnose it.
Try to go sugar-free in your meals. Eat more fruits and veggies, along with moderate daily exercise. Our lives can be so sweet without sugar too. Let's all work together to fight diabetes every day.
Merck Foundation. No more diabetes. Reverse diabetes. Goodbye diabetes. We can make it work. 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 Push back diabetes. No more diabetes. Reverse it. We can make it work. We can make it work. We can make it work. We can make it work.
So now we'll invite Dr. Anne Waragu.
Thank you. Good afternoon, everybody. My presentation today, I'll be focusing mostly on hypertension, diabetes. And the topic of the day will be promoting a healthy lifestyle and raising awareness about prevention and early detection of diabetes and hypertension, and the role of the media of how to report this to the community. So as you know, as you're familiar with, I suppose that both hypertension and diabetes, they are referred as non-communicable disease. What do you mean by non-communicable diseases? These are diseases that you cannot pass from one person to the other one, although there's some genetic, that's not communicable diseases. Communicable diseases are the infections that when maybe somebody has a cold, you can pass it to the other person. HIV, you can pass to the other person. But non-communicable disease, they don't easily pass from one person to the other one. Apart from diabetes, hypertension, there's also cardiovascular diseases, cancer, and the chronic respiratory diseases like asthma and COPD. This non-communicable disease is the result of a combination of mostly genetics. So you're genetically predisposed, you're at a higher risk of getting these conditions than somebody who doesn't have that genetic predisposition. Physiological environment to think about the things, what the kind of environment you're living in, behavioral factors like exercise, like substances use like alcohol and cigarette smoking. And what do these non-cardiovascular diseases do? They are the leading cause of death worldwide and represent an emerging global health threat. And for Africa, we have the double burden. We're still struggling with the infectious diseases and yet now the non-communicable diseases are on the rise. These are the ones I talked about: high blood pressure, which is the same as hypertension, diabetes, just an elevated blood sugars, heart diseases, especially the coronary heart diseases, normally commonly referred as the heart attack and the like, stroke, chronic respiratory disease, and various cancers. Let's first focus on diabetes, then I'll talk about hypertension in a few. What is, as a cartoon, the video that has already been shown, they've already defined what is diabetes. Diabetes basically is a chronic. When you say chronic, it stays in the body for, is a long disease as opposed to acute disease. When you talk about infectious disease, mostly acute. Like when malaria, within a few days is already sorted out. But chronic disease tends to be like lifelong conditions, and it's metabolic, characterized by elevated or high blood sugars, which over time will results to damage of various organs, as shown: the heart, blood vessels, the eyes, kidneys, and the nerves. How does diabetes present? Majority of patients may not have any symptoms, and hence now we talk about patients being screened, and I'll talk about when do we do the screening. But as you saw, that young boy, he started having excessive thirst, which is medically referred as polydipsia, excessive appetite, polyphagia, excessive urination. You saw him passing a lot of urine, which is referred as polyuria. They lose some weight, especially when the sugars are quite high. Then some patients, they talk about having blurring of vision, and they generally feel tired, amongst other symptoms. As you can see, these are still the cartoon, which is showing the same other symptoms that you can see. The flat feet, they could be having something called peripheral neuropathy, where the patients complain of tingly sensation on the feet. They feel pins and needles sensation. They can also experience numbness, and sometimes they can present with ulcers on the feet. There are various type of diabetes. Although this slide is showing only 3, I'll try to expound on the others. The commonest type we have is type 2 diabetes. And what is type 2 diabetes? Type 2 diabetes normally affect older adults. When you say older is when you say above 30, sometimes you go up to 35 years of age. And normally is as a result of insulin resistance. Somebody has enough production of insulin, but with time there's some resistance because of the lifestyle issues, like sedentary lifestyle and weight increase in weight, and forms at least 90 to 95% of the diabetes we have. So majority of the patients we meet in our clinics are mostly type 2 diabetes. Let's move to type 1. Type 1 is for younger people. Normally you can get a young child from 6 months can have type 1 diabetes, and all the way to 30 years of age. Those are the one we talk about type 1. These are the result of autoimmune condition. Your body, for one reason or the other one, produces some antibodies which affects the beta cells of your pancreas. The pancreas is an organ which now produces insulin. So when your beta cells are affected, your body no longer can be able to produce any insulin. And these are people who, these are the type of patients who have to be put on insulin in their lifetime, because the problem is that they don't have insulin. Whereas a type 2, they may have a bit of insulin, they may have enough insulin or reduced insulin. And as the disease is progressive, you may lose some of your beta cell function, not because of an autoimmune, but because of the elevated sugar can be toxins to your beta cells. So type 2 diabetes is a different pathology. And when you're managing type 2 diabetes, they may need insulin at one time, but majority of patients, they can be used tablets. But again, we can combine the two. That makes a difference between type 1 and type 2, that the type 1 are much younger, type 2, they're older, and the treatment approach may be different. In pregnancy, we may have what is called gestational diabetes mellitus, GDM. This one is when the sugars for the first time is diagnosed during a pregnancy, and normally we talk about the second or that trimester. So these one normally resolve after the mother has delivered. But what happens with these patients? They're at a higher risk of developing type 2 diabetes later in life. So somebody need to be followed up. So you find somebody in the early gestation, the first trimester, having diabetes, patient can be having already pre-existing type 1 or type 2 diabetes. That doesn't mean because you have, when you have type 1, type 2 diabetes, you cannot become pregnant. But when you have it, it's no longer, it's not called gestation diabetes. That would be diabetes in pregnancy. The other types of diabetes we may have, there's some which are in between type 1 and type 2. We have a type 1.5. Type 1.5, you know, also like a type 1, like type 1 diabetes. It's a late onset type 1 where they also autoimmune antibodies, where but this patient tends to be older, like the type 2, so they can be confused. But in the latest time, we have now, they have identified other types. We have like type 5, which is related to malnutrition, and getting it a lot in the sub-Saharan Africa and in some Asian communities, where because of childhood malnutrition, patients are now developing another special. This was documented last year, so it's a new, so you may not have heard about it, but now when you read the latest, some patients may come and ask, what is type 5 diabetes? But again, there's so those patients who get diabetes because of a problem which is affecting their pancreas. You can have chronic pancreatitis. Maybe you have taken a lot of alcohol, and the alcohol has affected the pancreas, so you're no longer able to produce your insulin. So you can get a special type of diabetes because of the insulin which is no longer being produced. So there's a secondary type of diabetes. There are some drugs which can induce diabetes, and most especially when you talk about the steroids are common drugs which are used for various conditions like arthritis, and when used not in the correct way, and the patient not followed up, somebody can develop diabetes out of that. So as you see, the other types of diabetes and some rare forms like MODY, I don't could go to the extent of that, but just be aware that there are different types of diabetes. What are the risk factors for diabetes? For type 1, we sometimes we don't know why this patient goes. It's just something which cannot explain. It's an autoimmune process, just antibodies start forming for one reason or the other one. And you have the type 1. So most of the time, there's no family history, but the patient has the type 1. Type 2, with the commonest risk factor, we have genetic issues. So there's when you have type 2, there's a likelihood of somebody in the family having type 2 diabetes than in type 1. When you're older, when you're 45 years and above, the Africans have been found to have higher, and the Asians as compared to the Caucasians. Sedentary lifestyle, you can see somebody just lying on the couch, then being obese or having overweight. When you have hypertension, then you're at higher risk of diabetes. When you talk about hypertension and diabetes, they're like twins. One, when you get one, the other one is high likely to be there. Patients with high cholesterol, and again cigarette smoking. Those are the risk factors that can lead to having diabetes. Again, with the unhealthy diet and excessive alcohol intake. Diabetes is associated with various complications. As you can see, somebody can get it. Can get various complications in their body. We can classify this complication into two. There are those on which affect the small vessels. The small vessels are found in the kidney. So you have something called diabetic nephropathy, or the vessels which are going to the nerves, so patient can get diabetic neuropathy. So like what I say, the patient comes with a numbness of the feet. And again, the eyes also have very small vessels. When they're affected, patient has got something called retinopathy, and in the worst case scenario, they may become blind because of the retinopathy. Then again, the large vessels, which is called the macrovascular complications. These are the big vessels of the body, and this one have one found in the heart, the coronary arteries. So the patient may have coronary artery disease or heart failure because of diabetes. And again, the bigger vessels in the brain, so patient can develop stroke. And the legs, they also have the large vessels in the legs, what is called peripheral arterial disease, where the patient, the vessels can get blocked, and we end up amputating the legs for such a patient. Other complications, we have sexual dysfunction, and this is both for male and female. And you find mostly we talk about the erectile dysfunction in the male, but you find also women have a challenge with their sexual function, which we rarely talk about. As I'm a previous presenter, I've talked about the challenges of talking about sexual dysfunctions amongst our communities. Other patients may get other complications like cataracts, and There's some skin condition that can get easily, you get infected easily because your immunity now when you have diabetes on the lower side. So there are various complications that can come about because of diabetes. When it comes to the management talk about the lifestyle modification. And this lifestyle is both all the cut across all the types of diabetes. And when you talk about nutrition, this is where a lot of controversy comes in and where the media need to be careful what they report. There's a lot of false information that is sometimes being passed around. So you need to be aware which kind of foods that the patient is supposed to be put on. And you have a nutrition in the house. I think she'll focus, I don't know if they should be presenting more on that. And we want to encourage patients to eat the proper kind of diet. Previously, you talk about a lot of fruits. I've heard that young man who was having diabetes in the crib, that was him informed to take a lot of fruits. But you're moving away from advising patients to take a lot of fruits because some of those fruits have a lot of glucose. Because I know fruit contain a component called fructose, and when this fructose is broken down to be turned down to glucose. So a lot of fruits are not they're not good in the management and prevention of diabetes. But again, you can be advised on the right type of fruit. There are those who have a higher glycemic index. When you're talking things like fruits like sweet watermelon, they have a high sugar content as opposed to an apple or an avocado. So again, the types of fruits, you need to be known which type of fruits. The type of fats, we talk about saturated fats, unsaturated fats. So there's a lot of information that the media can help us to pass around when you're talking about the nutrition and involving the right cadre of people to talk, so that you don't pass the wrong information about which kind of a diet, because this is an area which has been affected by even non-health professionals talking about the diet and not in the right way. How do we prevent diabetes? Type 1, we can't say we can be able to have found a way of preventing it. We can't even screen it because it's something which just happens suddenly. So we don't, when you talk about this prevention, normally we are focusing on the type 2, as we said, is a commonest, so we better talk even just about it. So one of the things is addressing those lifestyle issues that you have talked about. So maintaining the healthy weight, being physically active, taking the right diet, avoiding any tobacco use. And we talk about tobacco use is whichever form. Majority of patients, they do cigarette smoking, but you're finding a lot of vaping where people are using the shisha and stuff. And some communities, they chew tobacco or sniff the tobacco. So we're talking about tobacco is not just restricted to the cigarette smoking, although it's the commonest mode of using the tobacco. Moving on to the second condition of the day, we are talking about hypertension. Hypertension, commonly people refer as a silent killer. Somebody who kills you silently without any warning. So this is where a situation where you can have elevated blood pressure and you're not aware and you don't have any symptoms to send you to the doctor. So there are people who walk around for many years without knowing they have hypertension, and only they present when they have those complications, like somebody having a stroke. And the first time he said, oh, this is the first time this person is developing hypertension. But this hypertension, chances are it was there for a long time. What is hypertension? When you say hypertension is when you say elevated blood pressure. There's a machine called blood pressure machine that is used to assess the blood pressure. The good thing with this blood pressure machine, they are easily available. You can buy over in the pharmacies. And there we have the digital one, so it's no longer required a medical personnel to take for your blood pressure. And you have reading, blood pressure measurements come in two reading. There's a first reading, which is known as systolic blood pressure. Systolic blood pressure is when your heart contract. What's the force that control the heart is called the pressure at which that heart is contracting. So this, when the blood pressure is more than or equal to 140 millimeters of mercury. When the American, they use lower cutoffs, because you may going to wonder how comes some areas they're talking about 130 for systolic. When it comes to the lower reading, so the second reading is called diastolic pressure. This is the pressure at which the heart is relaxed. So there's the one the heart contracts, systolic pressure. The one that when the heart is relaxed is called this diastolic pressure. So in most places, most guidelines, they talk about a diastolic pressure which is more than 90, whereas by the American, they're using lower levels of more or equal to 90. And it's not a one-day reading. So when you come to the hospital, and maybe the first time you're coming to the hospital and you find your blood pressure is higher than this, we don't tell you hypertensive. We need more readings to the blood pressure needs to be shown that is persisting more than a one-off blood pressure measurement. This hypertension is a leading cause of cardiovascular disease and mortality or death related to cardiovascular diseases. Again, the risk factor, just like in diabetes, they are just similar, but even for diabetes, they can be classified into two. We have modifiable risk factors and non-modifiable. When you say modifiable risk factors, we mean that they are risk factor that we can change, we can influence, we can modify. So when you talk about unhealthy diet, that means you can modify your diet to the correct diet, and either you reduce your risk of getting this condition or actually you manage it in that way. Physical inactivity is modifiable because you just need to start doing it. Consumption of alcohol and tobacco and again can be modified. Issues about weight can again be modified by doing the right thing. So this risk factor, they can be used either for prevention. So when you do the right thing, you can reduce your risk of getting this condition. But again, when you already have the condition, that means they're the same things that we can modify to either manage or either they can be used as the only way of managing. There's some patient who may, when you start on this lifestyle, they don't need to be on any treatment, but majority of patients, they require to modify this risk factor as well as the drug that your doctor is going to prescribe. What about the non-modifiable? There's nothing much you can do about it. Either when you're doomed, is in the family, is in the family. You can change your family. Even if you change from being from this community to the other one, your genetic makeup just basically remain the same. You can't modify your age. As you're aging, our blood vessels change. They become a bit hardened, and there's nothing much you can do about it. Although sometimes when you modify our lifestyle, sometimes you can modify how fast we are aging, because you can have a 60-year-old who, when you look at their vessels, they're as young as a 30-year-old, whereas a 30-year-old who is not taking care of their body, we can check the age of their blood vessels and if they have aged. So maybe there could be modification in that way. When you already have a coexisting disease like diabetes, kidney disease, that means you're at higher risk. But again, diabetes, hypertension, there are those one we cannot tell why they have. But again, there are patients who get hypertension because of a secondary issues. Maybe you've used drugs like the steroid. Maybe you have an endocrine disorder. So again, the hypertension, again, you have to know what is the cause of this. Younger people, when they come, we need to find out, do you have an endocrine disorder? Do you have a kidney disease that is giving you hypertension? I know the other way around, because again, when you have the hypertension, you can have a damage to your kidney. So majority of patients, as I say, they can be asymptomatic, and that's why hypertension is commonly referred as a silent killer. And by measuring the blood pressure is the only way that you can identify that you have hypertension. Otherwise, by just looking at you, we may not know who has a patient who has hypertension. However, there's some patients who may have some symptoms, and these one they come in early morning headaches, some nosebleeds, irregular heart rhythms. Some patients tell you their vision is not good. Some they have the tinnitus or the buzzing of the ears because of the very high elevated blood pressure. Some patients they come with the complication of hypertension for the first time. The patient can come with a heart attack, patient can come with renal failure, patient can come with a stroke for the first time. So they can present for the first time with the complications already. When the blood pressure are quite high, we're talking about systolic pressure of more than 180, and some patient actually is more than 200. This is quite severe hypertension. And the patient may come with confusion, they may vomit because of increased intracranial pressure, chest pain, and they may have some tremors. Again, the complication, they share the same complications with the diabetes. So we can say these are dual, they have the dual effect. When you have now the two diseases coming together, basically you're being challenged because you're at two times a risk of getting this complication than somebody who has either of the condition. As I said before, the issue about the stroke, heart attack, kidneys, blood vessel, they're shared to among us the two conditions. Again, how prevention is what something we need to talk about. Again, we use the same methodology, but for hypertension per se, salt plays a big role. It doesn't have a major role in any role in the diabetes. But now when you talk about, we need salt, which is sodium chloride, for those who have done their chemistry, we need to lower the salt. And when you say less than 5 grams, you may wonder, do we have a weighing machine where I put salt and measure how do I distribute that for the whole family? So when you talk about some foods already have salt. It's already so some food, then natural food has some salt in it. So what we do generally is to reduce the amount of salt you're taking in every meal. Avoid those added salt, especially salt shakers should not be on anybody's table, because I've seen people even before they start eating, you just put a lot of salt. So then cooked salt is even worse than the one you do during the cooking. So we want to minimize the added salt, but the natural, sometimes there's nothing much you can do. Fruits and vegetables, again, they have a role. In diabetes, we said we need to restrict which kind of fruits, but vegetables, there's no restriction. Actually, in diabetes, we say the patient should have plenty of vegetables than the rest of the meals. Then the issue about the fats, the issue about avoiding the tobaccos and alcohol cuts across both diabetes and hypertension prevention. How do you control hypertension? Basically, once you made the diagnosis, we need to be on a follow-up in the clinic. Majority of patients, when they know the hypertension, they just come for 2 or 3 visits. Then along the way, because every time you come to the clinic, you tell your blood pressure is okay. So you're wondering, why am I going to the clinic? But in the clinic, we're able to modify sometimes some of your treatment. We're able to request you some of the tests. Although when you're well controlled, you don't need to be followed up on a very short duration. Sometimes we give you even return dates of actually 6 months, and even some basic clinic, you can get a return date of even 1 year. What we want to encourage our patients is that when you have your BP machine, you can be able to monitor, and maybe you present to the doctor when you find there's an issue, but you need to maintain your regular follow-up. But in between, blood pressure needs, you need to inform the communities that they need to be checking their blood pressure. The good thing, we have the community health providers in the rural villages. We're able to move from one house to the other and able to do the blood pressure. But majority in the towns are able maybe to afford a BP machine, which can be able to help even monitoring. Then you take the medicines as prescribed. If the patient has a problem with any of the tablet, normally we inform you, please go back to the doctor who prescribed. Sometimes it's already a known side effect. There's some drugs, when I put, you already know this drug can cause some leg swelling, and when you have those leg swelling, I decide to modify, I change to another drug, or even maybe reducing the dose, and you're able to tolerate the drug. So each one of these drugs have their unique side effects, but the condition, the disease itself, has more complication than the drug themselves. So most patients, there's this myth that when you take the drug, you become addicted to the drug, so you cannot withdraw the drug. So again, there's a lot of myths and misinformation that hangs around there. So when your patients experience any of the side, we don't have these drugs are harmless. They have their own unique side effects, but if you're a doctor who has been trained on this drug, or is already aware there's a drug I put you, I know you make cough, and you come back, I tell you, oh, this cough is because of this tablet. So being followed up, you're able to be reassured, and the drug, your medication can be assessed. And issues about stress, I know we are so stressed in the current situation. Things sometimes they're not working in different countries, and stress is one of the causes of hypertension. So even as we are addressing the other lifestyle issues, stress, and again sleep again is coming quite big in the management of diabetes and also hypertension. People are sleeping less hours than they're supposed to be, and this is quite presenting as a major risk factor. Again, when you're managing, we need to ensure this person is sleeping the enough hours, and people can manage stress. So sometimes the management of stress requires us sending you to a psychologist for evaluation of what is causing that. Where do you come in as a media? When it comes to the media in issues about health, you're not just a messenger, you're a game changer. You can do so much in this area, because when you link up with the healthcare providers, When you do those reports, your stories, the one you give to the public, they're able to change the some of the major factors. What you talk about, the nutrition, you're able to influence a bigger population, especially when you do the correct kind of the correct kind of reporting, means the good information. And how do you get this good information? You're able to link up with your healthcare provider, with the Ministry of Health, with certain professional community societies, so you'll be able to know, with this kind of condition, which information can we give. Don't just go to the Google and just think that way, because you've read it, you're able to understand. Sometimes you need a medic to even interpret what you've already read. With the Google doctors around, and everybody having able to access the chat GPT, we are finding patients are more even informed. So sometimes you may think, do I need the doctor? You still need the doctor to interpret that information, because it took a doctor more than 6 years and above to understand some of these conditions. So as much as people are able to read for themselves, there's a role of the healthcare provider to be linked up in this. So the media, the fourth, you call it the fourth estate. And when you talk about the social media, actually, there's a new rise of the fifth estate. I think that's the notice. No, when you talk about the TikToks, those are now becoming the fifth estate. They have the healthcare providers to expand the audience reach, because as much as maybe the number of patients I'll see today, I may be able to see between 10 and 20 patients. Those are very small percentage of how much information can I give. How much time do I have as a doctor to provide the community with this information? But when you come in, you're able to address, when you're writing something on newspaper, somebody is on TikTok, somebody is on the TV, somebody is on the radio. The mass is able to reach. They're even at not just local. They're not restricted at local levels. They're even at international level. That information can reach even a bigger audience. And the media plays a big role in educating the public about the health concern. You have a responsibility to report accurate health, because inaccurate reporting, which you're finding a lot of challenge. We find somebody reporting and they didn't even understand the topic. They think they know a lot. And this is bringing a lot of confusion among us, our healthcare providers. When the patient comes and tell you, I heard over this radio, they're telling us to do this, yet this is not the correct information. They create mistrust, because the community may be able to trust the radio station of a popular somebody they like. By the time this person is coming to you, their knowledge is already damaged. But for you now to trying to change that way of thinking from this person, and they believe what they've been told. So sometimes you're getting a bit hard trying to change what the patients has had out there, and yet to know it is not the correct kind of information. So before you pass any of this information, seek clarity, get those. We have so many professionals who are out there, and sometimes we give most of this information, or rather our services, to the media free of any charges. I've attended quite a number of TV station. You have had Uria Daktari in the Kikuyu vernacular. Nowadays in Kiswahili you have Uliza Daktari, and you find a lot of doctors volunteering to go and address some certain issues. So you just need to inform us, and you're able to be available to give the accurate information. Then the media plays a supplementary role by being integrated into the program that include face-to-face and other forms of intervention. More role, you can have any levels, different levels. You can go to individual, networking, organization, and society level. So the fourth estate and the fifth estate, you have in health, the correct information, link with the healthcare providers. That alliance between the media and the healthcare providers is a very strong alliance, where now you're able to focus, the patient is able to trust what the media is telling you, and the doctor and the media, you're giving the same information, so that you don't create a lot of confusion and mistrust among us, the patient. Again, the media can be used for health promotion, for these lifestyle things. You can show which kind of fruit, or rather the foods to take, the complication that comes because of cigarette smoking. So all these things, the media can be able to highlight. How do you prevent these diseases? And the goal is to basically to enhance a state of well-being, to guard healthy and population at risk. think that brings me to an end.
Thank you, Dr. N. And now we will move to our next speaker. So we have a very new topic today on the health media training with East African countries. So we have a speaker, Miss Lucy Shega.
Thank you very much, Merck Foundation, for this opportunity. Indeed, we can't talk about nutrition. We cannot talk about health and leave nutrition. Nutrition is health, and we cannot address matters health without recognizing the role of nutrition in shaping a healthier future. So I'll be handling the topic nutrition education and awareness, that is building a healthier future together. And so every day, several times a day, you make food choices that influence your body's health for better or worse. Each day's choice may benefit or harm your health, only a little. But when these choices are repeated over years and decades, the rewards or consequences become major. That being the case, paying close attention to good eating habits now can bring you healthy benefits later. Conversely, carelessness about food choices can contribute to many chronic diseases. Like the case of Jude in the animation, you have seen that he started eating unhealthy and later he had some issues to deal with, that is diabetes. So sometimes eating carelessness might not make sense, or eating healthy might not sense, but later on, what you ate can come to echo in your future. Exactly. So how can we achieve a healthier future together? So we are going to focus more on our children. That is cultivating healthy eating habits in our children. And these are some of the points that I'll be tackling. That is encouraging kitchen and school gardening, encourage families to develop their own meal plans, engage parents and the wider community in nutrition education, integrate more sporting activities into school calendar, integrating nutrition education in school curriculum, and here in Kenya, this is being achieved through CBC. Why kitchen or the school garden? Having a kitchen garden promotes healthier eating habits in families. How? There is supply of fresh and seasonal produce. It's always advisable that you take advantage of the season of fruits, season of vegetables, because they are cheap and they are easily accessible. So when you have your own kitchen garden, when you have your own school garden, you're able to access fresh produce right from your farm. And also the produce from our kitchen or school gardens, there are less to no toxins in the produce. So they are very organic and chemical free. And also having a kitchen or a kitchen garden, it keeps children away from too much screen time through gardening activities. And also it helps children learn real foods. And also it cuts down on the cost of affording a healthier meal. If you have your own vegetables, if you have your own fruits, at least the money that you had set aside for your meal, you are able to access other food like your proteins and other food groups. So it cuts affording a healthier meal. And also it's an opportunity because it offers a diet diversification, a key component of healthy living. So these are some of the benefits that comes with having a kitchen or a school garden. The role of family meal plan in promoting healthier eating habits. Knowing what's for breakfast, lunch, or dinner each day reduces last-minute decisions that often lead to unhealthy choices. With all the food couriers that we have in each country, I know it's tempting to just order, but when you have a well-tailored meal plan, it's a opportunity for you to avoid these last-minute decisions. So how does it help in healthy eating? It provides an opportunity for parents to model healthy eating habits, that is to our children, and there is more intentionality to food choices. When you sit down with your family, you are trying to make a meal plan, you are more intentional to giving your family the best. So there is that intentionality to food choices. A well-thought meal plan offers diet diversification, ensuring there is intake of variety of food group. I think I have talked about the diet diversification. It's a key component when it comes to healthy eating. Diet diversification meaning that you are eating different foods from different food groups. Number 4, it reduces unhealthy in between meals. Those are the snacks, since everything to be consumed each day has been included in the plan. Also, it exposes children to a variety of foods through introduction of new foods regularly. This reduces picky eating later in life, since most of the foods look familiar and enjoyable. And also this when you're talking about introducing variety of foods, this one you are beginning when you are weaning or when you are doing the complementary when you are doing the complementary feeding. Don't wait until a child is 5 years. That's when you're trying to introduce a new food. Introduce them to variety of foods when you are giving them food for the first time. That is weaning or the complementary feeding. And also it promotes cooking involvement. When children help prepare or plan for meals, they become more interested in trying new foods and learning about nutrition. Let's involve our children in the kitchen. Let them know different foods, how they are cooked, why you are doing this. If the vegetable, why are you not overcooking them? Let them understand each and every step of the cooking, and they will enjoy more foods, and there will be no that withdrawal when it comes to food. Then when you're talking about a family meal plan, it is more than just a menu. It's a practical tool for guiding consistency, healthy food choices, and building lifelong eating habits. We are going to look at the role of nutrition and physical activity in preventing and addressing childhood obesity. And we have a statistic there from WHO. Childhood obesity has become a global public health concern, and one major factor is the imbalance between calories consumed and calories expended. Like in 2024, that 5 million children under the age of 5 were overweight. And 1 out of 8 people in the world were living with obesity. That is in the year 2022, according to WHO. Eating habits that we instill in our children play a foundational role in shaping their health as adults. For example, a child who consumes excessive calories from sugary snacks or drinks but leads a sedentary lifestyle is at a higher risk of weight gain and other related complications. So, what are some of the strategies for preventing the childhood obesity? We encourage more creative outdoors activities, that is, playing with their peers, kitchen gardening, and this will help. And also, talking about the kitchen gardening, this will also help our children know where food comes from. You'll be surprised that most of the kids, they know everything comes from the supermarket. The vegetables they are bought in the supermarket, they know that they don't know that there is farming that comes with growing all these vegetables. So when you encourage outdoor activities like kitchen gardening, this will help children know where food comes from and appreciate all those processes. And also engage children in food preparation and cooking. Like I've said, kids tend to enjoy more food when they are involved in cooking method. This will also teach them about portion size, a key component in managing calorie intake. Also, we limit screen time by giving alternative activities like food preparation. As a mother or whoever is in the kitchen preparing the food, involve them, take them away from the screen, because also when it comes to too much screen time, that's why we find that the calorie expenditure is way too low compared to the calorie that we are giving our children. So involve them in food preparation, other chores, and distribute all these chores among the family members. Also, provide healthy snacks, and to avoid refusal, give healthy foods while a child is still young. They will grow up appreciating healthy snacks over bad ones. This is why I said when we are weaning our children, when we are introducing complementary foods, give them healthy foods. A child, whatever you give a child will grow up knowing this is the kind of food that I am supposed to take. So introduce healthy foods as early as young as they are. So when you give, for example, when you give too much the canned juices, and later on you are giving your child a whole fruit, they'll not appreciate that because they are used to too much sugar when you are giving them the canned juices. So for the foods, introduce healthy foods as young as the child is. And also, prevention of childhood obesity is not a responsibility of one person or institution. It requires a multi-sectoral approach involving the families, schools, healthcare providers, the policymakers, and community. Establishing healthy habits in childhood, like enjoying nutritious meals together as a family, staying physically active, and learning to make informed food choices, lays the foundation for a healthier, more vibrant adulthood. This is where, like, whatever you're taking as a child, it will come to echo. Whatever we are giving our children will come to echo in their adulthood. Strategies for encouraging healthy snacks choices at school. So as schools, they are uniquely positioned to influence this outcome by offering balanced, appealing meals, not just giving our children food to fill their stomachs, but as schools, the school management should ensure that the meals that are being given to our children, they are well balanced and appealing. And also, they limit access to healthy snacks. That is, the school canteens, they can eliminate the unhealthy snacks and give access to more healthy snacks. And also embedding nutrition education into their curriculum. I think this is something that is currently happening in our system here in Kenya. And also teachers and school staff should act as role models, eating well, staying active, and also avoiding the use of food as a reward or punishment. School policies can also limit marketing of unhealthy foods and ensure that vending machines and cafeterias align with nutritional standards. The importance of engaging parents and the wider community in nutrition education. Food is communal, and for us to create a supportive environment for a healthy eating, we must engage those who shape our future, and the future here being our children, and the parents, caregivers, teachers, and the broader community. We have or we share responsibility in modeling and reinforcing the healthy behaviors. Eating habits are not merely preferences, they are reflection of values, environment, and knowledge. Children raised in homes where fruits, vegetables, and whole foods are prioritized are more likely to continue making these choices as adults. On the other hand, consistent exposure to sugary, salty, and high-fat processed foods can lead to a preference for such items and increase the risk of obesity and other chronic illnesses later in life. This is where I said that the food choices that we help our children make, they'll come to echo in their adult life. So it is our responsibility that we shape our children in making wiser and healthier food choices. This is just an example of meal ideas that are kids friendly. I think I will not go deeper into them. Those are just examples, a combination of healthy meals that they are healthy and kids friendly. Tips for a healthy lifestyle: eat more fruits and vegetables, but this is exceptional to diabetes or pre-diabetes people, which is it's a whole topic on fruits. And also drink enough water, cut down on highly processed food, too much salt or high sodium containing foods. And these too much salt and the sodium containing foods, we get them mostly the canned foods that are in our market, in our supermarkets. That's why you can get the foods that are very high in sodium, and they are hidden. They are the hidden sodium and the hidden salt. Also limit the intake of added sugars products. These are example of the wheat products, the wheat products that all those the cakes, ice creams, all those. And alternatively, and also the fruit juices, for example, instead of giving a fruit of the canned fruit juice, you can give you can make yours, if your child wants a juice, instead of getting them one in supermarket, you can make advantage of the seasonal fruit that is there and make juice out of it. Also reduce intake of deep fried and fatty foods. Also sleep is very important, and also develop a workout schedule. And when we are doing all these, we are involving our children. If it's developing our workout schedule, we are not doing it as caregivers, we are not doing it as parents only, we are involving also our children. And also a very important part that I left, it is the role that the media plays in promoting good nutrition. The media, when it comes to promoting good nutrition, it has a role in advertising. Let's be more aware and sensitive on what we are marketing as healthy, and also health and nutrition shows. Currently, we have health and nutrition shows that are happening, but we'd love to see more of this. And also, let's have more health and nutrition talks at community levels, and this we can achieve this by at community levels by giving them in their own local language. I think a media you have a role to play. And also, we want to see more of the road shows sensitizing on good nutrition and healthy living lifestyles. And also, as media personnel, you are a role model to many, especially our children. They follow your lifestyle to an extent of copying your own dietary lifestyle. So, as an individual, know that you influence a bigger community and you have a role to play when it comes to guiding or shaping a healthier future. And in my conclusion, I'll call to action. If we wish to raise a generation that values wellness, we must start now. The choices we guide our children to make today will echo through their future lives. Thank you.
Thank you so much, Miss Lucy. And now Merck Foundation Health Media Training is Media Health is meeting media now. So this is a time for our next speaker, who's a media, Miss Christine Naguku. Please welcome Miss Christine.
Thank you. I really appreciate the introduction. So today I'm going to just take you through, how to begin to break the silence. We will also talk about why it matters, for journalists to be in this discussion and this conversation. We will also look at some of the strategies that you can use in addressing some of the topics that were discussed today. And then we will almost close by talking about the impact that you can make as a journalist and how to go about, telling the story. So I start off by making a case for breaking breaking the silence. Somebody on the chat asked a question, and I have actually responded to that question. And what I have said is that we do not talk about infertility, especially because it has to do with sexuality, and because in Africa, the subject of sexuality is very contentious. It is supposed to be spoken about, if you like, in whispers. It is a subject which people are not very comfortable discussing openly. So how do we break that silence? I have said that we need to just open up spaces where people can share their experiences. We look at the successes, the challenges people have gone through, and how they have overcome those challenges. So we can begin by just talking about it, giving space for it. The unfortunate thing is, even the young generation, in Kenya, we have this particular reference to the young people. After the millennials, we are talking about the Gen Z, the generation Zoom. Unfortunately, the generation Zoom, who are now in their late teens and early 20s, have also begun to stigmatize issues to do with infertility. But when you look at it, and later on we will talk about it, when you look at it in another perspective, you will realize that the stereotyping is like handed down on the socialization thread. So we need to look at it and say, we can start to talk about infertility, we can start to talk about gender-based violence, we can start to talk about openly about female genital mutilation, we can start to talk about even the lifestyle disease. I remember a time, even not too long ago, where people who had diabetes would keep it hush-hush. In fact, some would even hide to go and swallow their medication because they didn't want people to know that they have diabetes, because nobody wanted to be identified with having a certain medical condition. So we can start by breaking this silence by giving a voice to the voiceless. People who have gone through infertility are never looked at in a positive way, like they have something to share. They're always looked at in a negative way. Then also exposing female genital mutilation. What is it about female genital mutilation that is not being talked about? The effects are not being talked about. The victims, or I'll say those who have lived experience, are not getting a voice. They are also not being talked about to highlight their own plight. We also need to think about having creative campaigning and collaborative storytelling. Somewhere at the end of this presentation, I'll talk about some of those collaborative storytelling ideas and suggestions that we can use. And when we think about the creative campaigning, it's like just once in a while, carry a full page or half a page about your nutrition and what it says to your predisposition to diabetes, your predisposition to obesity, your predisposition to infertility. You see, most of society does not link infertility to nutrition. And so it is our business to now make it known to them. It's a creative way of saying, what did you have for lunch today? Could it be contributing or taking you closer to diabetes? Could it be taking you closer to obesity? Are you thinking about it? Then now the public or our audiences start to think, what is it that we can do? Then there is the gender-based violence reporting for prevention and justice. You see, we like to highlight the incidents, and we forget about talking about gender-based violence to prevent it from happening, to bring justice for those who have gone through gender-based violence. It's very, very, very key. And now I want to just highlight and say, on a day like today, there's technology-assisted gender-based violence. So you need to think about gender-based violence in its widest perspective. When we talk about gender-based violence, it's not just physical. It's not something that you can see. It could be psychological. And so we need to start reporting it for prevention. Think about women's empowerment and how we can highlight the success stories and the economic inclusion of women in issues empowerment, in issues economic empowerment, in issues decision-making. How well are women empowered to participate in policy making? We need to start thinking about how to combat infertility stigma. For example, get the young people to talk about infertility. Right now, any teenager you ask will tell you, oh no, I know at the time when I will want to have my children, I will have my children. There is no guarantee if you've not been taking care of yourself. If you are smoking shisha every weekend, if you are taking drugs, and you see, until we bring out the question of how easy it is for one to get into infertility, then people begin to talk about it, and how then we can begin to combat the stigma around it. If a person does not have a child, it does not mean they're not a mother. I know many women, some even my close friends, who have gone out and adopted children, and they are 100% a mother. Just the fact that you did not go through pregnancy and giving birth does not mean that you're not a mother. Hence the reason for Merck Foundation to start More Than a Mother. More Than a Mother is not about whether you gave birth or you didn't give birth. It is, did you take care of a child? Did you nurture another life without necessarily carrying it for 9 months? 9 months is a very short time. When you think about the lifetime that somebody who has adopted a child gives to a child until they are at the age of 18 or even older. I know my mother was still taking care of me when I was 20. I know she still cares about me on a day like today, and I'm in my late years. So it's important that we think about infertility and motherhood aside from pregnancy. Then girls' education. We need to start driving awareness and the need to have girls enrolled in school, but to transition and complete their education. We drive that campaign until the girls are all enrolled in the preschool level. But then what happens after that? After that, we forget about it. After that, we get into other issues and we forget whether this girl has transitioned into the next. So we start finding out that it is important to go with the campaign all through. Why does journalism matter in this discussion? Because journalism is a catalyst. I have put there a picture of a very beautiful Kenyan girl. Her name is Sarfin Acheng, as you can see, and she works for the national broadcaster, Kenya Broadcasting Corporation. And for her, she's been writing award-winning stories about empowerment of women, highlighting the plight of women and their health. And so she has been awarded internationally. Now, this is somebody that we need to celebrate. And when you see your story being recognized, it means you have become that big catalyst. At the same time, you've also begun to tell the creative stories about infertility, about health, about gender-based violence, telling the personal stories which humanize all those stigmatized issues. We've also seen that these journalists have impact in terms of shifting the norms. What happens is we build the capacity which fosters reporting on infertility, GBV, and related issues, which demonstrates that the media plays a very critical role in influencing community perspectives on some of these issues that we are discussing today. Again, journalists matter because they fuel cultural change. The minute community starts talking about infertility, about gender-based violence, about FGM, and supporting women empowerment, then they are beginning to accept and say, we really need to rethink our FGM practices. We really need to rethink gender-based violence and fight for policies that push for equality, policies that push for more empowerment and education for our women and girls. The journalist sits at the center of where information is shared, where information can be obtained, So it's important for us to always remember that. Now, to just bring the reality of infertility, you have a picture of this lady, and this lady seems to have done a pregnancy test, and then all the questions are coming. Where are my grandchildren? Do you want to have children? You'd be such a great mom. All those very harmless questions build the stigma. Among friends, people are asking, you'd be such a great mom. But at the back of her mind, she knows that she has infertility issues. You don't have children, you won't understand when a child does this, or you won't understand us who have children. Those are very stigma-prone statements. So we need to begin to highlight this and be sensitive to people who have infertility conditions, because that infertility condition can be overcome. Every woman can actually become a mother. You can either do fertility treatment, you can either adopt a child, and you can even foster a child. And so that brings you to become a mother. So when people are insensitive and say, you don't understand because you don't have children like me, you're being very insensitive. Sometimes we are making these statements without knowing, not knowing whether the person has fertility issues or not. So we need to be a little sensitive in our reporting and highlight the sensitiveness that audiences and communities need to be aware of before they can begin to make some of those statements. So now let's go to the crux of it and look at infertility and what are some of the things that we can do. When you think about infertility, what are the challenges? The challenges that we have to face as journalists is the cultural taboos. We are reporting about cultural taboos. We are blaming women. We are looking at social isolation. And then what is the impact of those challenges that we've talked about? The challenges are there is mental health strain. There are broken relationships. There is gender discrimination. When you think about all these, there are stories that can be done and written about all of these. So what's our role in as far as infertility stigma goes? One is to use human interest stories to humanize the issue. Meet a woman who does not have children or who did not get children but has adopted. Start the conversation from someone who is not at the center of the stigma. Let her tell you how she overcame the challenge of not having a child and what her story is. You start there. Even that one who has no child, has not adopted, and has not gone through IVF, and is maybe undergoing fertility treatment, they now will say, oh, you mean that other woman can speak? I can speak too and give my experience. Okay? You will find a father who was unable to have children. And what options did he take? You see, we think about infertility as a women issue. It isn't. We have just been told in this training that infertility cuts both ways. So we can highlight the medical facts and the local solutions that can be found. Highlight the voices of men as well. Highlight the voices of the experts, the doctors, the nutritionists. These are people who can actually share with us information that we can share about infertility and the stigma to try and reduce the stigma and eventually get rid of it completely. We can also feature male voices to challenge those gendered blame. It's not just women who get infertility, even men can have infertility. Let's have someone there who can actually own up. What about female genital mutilation? In female genital mutilation, there are what we call the definition of it. What does it entail? It entails harmful traditional practices which violate women and girls' rights. You see, every girl and every woman has a human right and does not deserve to be violated, especially FGM, because this is usually against her will. And it has other effects much later. Sometimes it makes them even bleed too much. Sometimes it can cause even other vaginal diseases, infections, and so on and so forth. It even kills their self-esteem. What are the consequences? Those consequences, what I'm talking about, the lifelong health problems, trauma. They live with trauma, the fear and the pain of what happened during the FGM, childbirth complications. We need to enlighten society about the lifelong problems that FGM can cause. You see, when they are making the decision for a little girl when she is barely 4 years, they do not see that child when that child is 27, 31, when she wants to have her children, and now she's having problems at childbirth. What is our role as journalists? Collaborate with survivors, people who have overcome the trauma of FGM, people who have overcome the health problems that come with FGM, people who have overcome childbirth complications. Let them tell us their story. Let us hear from the health experts. What is their experience when they are helping a woman who underwent FGM in delivery? And what can be done to try and help that woman? How can we intervene? Okay. Let's also talk to the activists, those people who do advocacy work. Can we amplify their voices so that FGM is reduced and our women and girls will be in a safer environment? Our role as journalists is to be sensitive also when we are reporting. Focus on dignity and resilience. When we talk to these survivors or lived experience, how can we focus on their dignity, their resilience, and the lessons we can learn from their experience? I mean, we need to build on their resolve, their will to overcome, and let others know that you can also overcome if this has happened to you. It is our time and our role as journalists to showcase alternative rites of passage in practicing communities. I know in Kenya, we have communities and even churches that have started alternative rites of passage where they say, instead of circumcising your girls, we will take those girls and the boys and put them in a sort of like a rites of passage camp. We will teach them everything about becoming a woman. We just will not circumcise the women, you know, because FGM, the actual cutting, was aligned to lessons of how to be a woman, lessons of how to be a wife, lessons of how to be a mother. So now they pick the girls, remove the FGM part, but teach them everything else. And if the church has gone into it, I believe even the mosques, it is time to get into it. It is time even communities began to have those kinds of gatherings where they have alternative rites of passage. The next one is about gender-based violence. Gender-based violence presents us with a very interesting situation. And we are talking about what is it that it does? What are the forms of gender-based violence? We've talked about the domestic violence, which is, physical assault. We've talked about sexual assault, harassment, early marriage. But I want you to take a step back and realize there is also mental torture. I think one of the presenters also mentioned it. So think about it as mental torture. It's psychological. What are the barriers to to the justice for gender-based violence victims? The stigma. How will I talk about that my husband has beaten me, or that I am going through psychological torture because I am a woman, because I have not done this, or because I have just not given birth? Who do I start telling? How will they see me? You see, that stigma makes people hold back, makes people not take action, makes the society not even be aware that such a thing is going on. So it's important for us to think about that stigma, open avenues for people to express themselves in dignity. Remember, in dignity and in respect. Also, sometimes there is a very weak law enforcement. Those who perpetrate gender-based violence, they may be arrested and then they are released. Or they may never be charged, Maybe even their punishment is too soft. So we need to think about how strong is the law in terms of protecting women against gender-based violence. So those are things that we need to write about. Fear of retaliation. If I talk about it, will I go through worse gender-based violence? Sometimes you may go to report to a police station, and you find that when you're reporting to a police station, the people you are reporting to subject you to more violence. They start asking you very intrusive questions. They start to ask you questions that, demean and remove your self-esteem. So what is our role as journalists? Is to ensure that there is safety for the survivors and there is confidentiality, especially in our stories. We need to keep the dignity of these victims intact. We need to ensure that they are respected. We need to ensure that they feel safe sharing their stories with us, because we are amplifying the story to make them stronger in their lives. It is our business to investigate systemic failures, especially where the law is very weak. We need to investigate. If somebody has been arrested or has been accused of gender-based violence, was action taken? Were they arrested? If they were arrested, what was the next step? And so on. If we find there is a gap, we need to highlight that gap. Use data to show the prevalence and patterns. How many women will go through gender-based violence? You know, I was a bit shocked when one of the presenters highlighted that there will be so many women, I think about 68 million women who will go through FGM. And that means it is a form of gender-based violence. 68 million women between 2015 and 2030, that's a span of 15 years. What does that number mean? It means 4.5 million women per year. 4.5 million women going through gender-based violence in the form of FGM in a year. We need to put a face to these 4.5 million women a year who are going through gender-based violence. What is the prevalence? Where is it most frequent? What are the patterns? When does it happen? What are the circumstances and the context around it? What are the issues around gender-based violence? What is it that presents a very good opportunity for people to administer or to do that gender-based violence? Now, thinking about girls' education, what are the challenges? Challenges of poverty. Africa has very many poor communities, and so they can't afford education. But you know, you need to ask yourself, why is it that it is the girl who is sacrificed and the boy is allowed to use the family's resources, whatever little they have, to go to school and not the girl? You know, those are critical questions we need to start asking. Early marriage. Why is the girl being married off at an early age? It is because the family is poor. They want to get some dowry from the other side, and so give out the girl. When the resources come in terms of dowry, that money, that wealth, those cows, those goats, are used to pay for education for the boy. You see, it's time we started to know how we are linking those dots. Menstrual stigma. Girls start menstruation and they stop going to school. Why? Maybe the boys are laughing at them. Maybe the teachers are criticizing them because they stained their clothes. Maybe they are feeling, I can't go to school because I don't have enough sanitary towels, or I don't even have access to sanitary towels. What is it that is causing girls to end their education early? It is very, very important for us to think about the challenges around it. Perhaps sometimes it is conflict. If there's a conflict between two communities, if there's a conflict in a country, people get displaced, and the girls don't go back to school after that. The men will always find a way to put the boys back to school or to give them some form of education. The girls, maybe not. Why does it matter? Because we need to increase economic growth. You know, girls' education increases economic growth. They become contributors to the country's economy. But we have never put girls' education and mapped it to the country's economic growth. So there are issues there. We need to reduce child mortality. Child mortality is coming because of girls' education being low. Remember, this girl did not go to school sufficiently, got married early, therefore she doesn't even understand good nutrition for her baby. There is a very high likelihood her children will die because of poor nutrition, because of poor hygiene, because remember, she was not enlightened. She did not get exposure to many issues and many subjects, so she doesn't understand too much. So girls' education also delays marriage. At least it gives the girl an opportunity to grow. But while she's growing, she's also getting exposed to the world, getting exposed to opportunities for economic growth, for professionalizing, becoming a professional, for taking up some of those dreams that she has had in her life. Our role as journalists, file the success stories of girls who have overcome some of these barriers we've talked about. Look for them. They exist in our communities, but we haven't talked about them enough. We need to also expose the discriminatory policies that do not push for girls' education, not just enrollment, but enrollment, transition, and completion. Those last two steps are always missing in our stories. We say, oh, so many children were enrolled, so many boys and so many girls. Sometimes it's even 50-50. Very good. Did you do a follow-up to find out whether that number of girls transitioned to the next class? Did they transition to the next level of education? If you look at those numbers, you start to tell a story. Again, if there are policies, we talk about them. How sufficient are they? Are they being followed, implemented? If there are no policies, let's start there. Can we have policies? What do we need to put in these policies to encourage girls' education? Can we also push for investment in girls' education, especially the infrastructure? And when I say girls' education infrastructure, this is what I mean. Girls enroll in school. They turn 10, 12, 13, 14, they start menstruating, and the toilet has no sanitary towel bin. In the school, there is only one little strip of, toilets, maybe 2 for boys and 2 for girls. Remember the numbers. Think about the experience of menstruation. You need to go in there, change your sanitary towel, have a good place where you can dispose of it, have a toilet which has water you can flush and clean out any blood that may have dripped. If that is missing in an education institution, girls will miss school for those days. They will stay home so that they can have that infrastructure for sanitation which is suitable. Those are stories which we don't remember to do. We go to a school, we look at the nice infrastructure, classrooms, yes, and oh, that is the toilet block. And then the story ends there. You need to go in there and interrogate that infrastructure a little more. When we talk about women empowerment, what are the dimensions? The economic dimensions of women empowerment. Remember, I just mentioned a little earlier that women contribute to the economic success of a country. If that women empowerment is missing, what is the economy of a country missing? Are women empowered to participate politically, socially, legally? Are they empowered to be guaranteed their rights? Those are things that we need to think about when we think about women's empowerment. Don't just think about the political, think about the economic, think about the social, think about the legal. Again, the barriers. What are the cultural norms around women taking positions of power, around women having economic success? You know, when a woman runs a business and it is successful, then we'll always wake up and say, hold on a minute, what's going on there? Why is this woman so powerful? Why is she able to make money? You know, is she able to keep her married? You know, now they start to bring in something else which is completely unrelated. Women have limited access to finance. I know there are financial institutions which have started giving finances to women, but half the time they can't find someone to guarantee them. Why? People don't have too much trust in women. They think, oh, when they take the money, they're going to spend it in chama. Chama is those women merry-go-round groups. They're going to take it and just spend it on food. Oh, sometimes we are even accused of taking that money, which is supposed to be capital for perhaps a business, for going to make ourselves look beautiful, to groom, you know. And I'm thinking we need to have a little more faith in our women. Perceptions of what women are. Those are things we need to look at. And underrepresentation in leadership. Are women represented sufficiently? Women may be represented in a community group, but what position of leadership are they holding? They may be in the leadership, but maybe they are just given the position of organizing secretary. Just organize the meetings. Why can't they be put in that leadership, but be given the decision-making position? You know, a position where they have a level of power, where they can mitigate society issues and say, Now this is what has come to me. This is the decision on the way forward. Our role, highlight those role models and mentorship programs that exist. Who are the role models in our communities? And a role model doesn't have to be a political leader. It could be a woman who is championing women's empowerment. It could be a woman who works in a certain institution, who comes from a particular community. Profile her and say, this is one of your own. And the girls in that community can see that, oh, they have someone to look up to. Someone has done it before. I can do it too. Spotlight on the policy reforms and any funding issues and opportunity that may arise that are directly addressing the question of empowering women. Again, how can we link women's empowerment to national development? We talk about women's empowerment as if it is removed from development of the country. Let's find those linkages. Those linkages are very important. When we look at all of that, you think about what are the benefits, What are the benefits? The benefits, I have put here something like an online store and a market swap. I'm talking about if we were to look at journalism as an online store, a place where you can go and trade your information and empower community. It's an exchange of information. It's an exchange of knowledge. It's an empowerment. We ourselves are like an online store where communities come, individuals come, gain information, go out and change the environment. The environment is that market. If we think about now journalism itself, going into the trenches, the ethical reporting guidelines, there are very few, do no harm. So we want to prioritize the safety of our sources. Remember, these subjects we are talking about are highly stigmatized, so people can face more increased stigma because we highlighted their plight or because we told their story. We need to think about talking about some of those weaknesses, some of those gaps, without compromising on the dignity of others. We need to also obtain informed consent, especially from vulnerable groups. Think about the FGM team. Think about the GBV teams. When you go to interview lived experiences, people who have lived through these vices, so to speak, in community, explain to them what it will mean when you conduct the interview, so that they can make a choice. Do they want to tell you their story and you hide their identity? Do they want to tell you their story and they are okay to deal with the consequences that will come later? But when you also get their story, you want to tell their story from a perspective of overcoming, not from a victim perspective where you're feeling, oh no, this is so sad. Oh no, she went through this. You don't want the audience to respond that way. You want the audience to say, this is a very strong woman. This woman overcame this. I can overcome that too. Use also the appropriate language and the reference. Avoid that victim blaming language where you profile the person as a weak person, as a person who has been defeated, as a person who is unable, just needs your help all this time. No. Think of the creative and innovative ways in which they have overcome the challenge that they have. Use also culturally appropriate terms without reinforcing the stereotypes. I know each one of us have a reference for women who have infertility challenges. I know we have a name for maybe somebody who has gone through GBV. When we repeat those stereotypes in the media, we reinforce them. So we need to be the ones who sift and use the appropriate terminology. The reason why I say this is because I know in the group that is listening, there are people who broadcast or who write their stories in vernacular language. And sometimes you can't find a positive local language terminology for FGM, for a person who has gone through FGM, for a person who is going through the medical condition that is infertility. So you need to think creatively and find a way. Maybe you are the person who is going to introduce a term that looks at that stereotype in a positive manner. And then also balance urgency with sensitivity. I know you want to carry that story today, but do you have all the angles? Have you amplified all the voices? Have you given an opportunity to the voiceless? So you need to think, how am I doing my story? Is my story complete? Is my story representative? Some storytelling techniques for you, especially if we want to impact society and for social change. Humanize the statistics. That 68 million, we probably need to go back and check. So how many women in our different countries have gone through gender-based violence, FGM, in the last 1 year? Or between 2015 and now, as we are now 5 years away from 2030, you know, what are the numbers? Connect those numbers to real lives. Put a face to those numbers. Then think solution journalism. There's one of the presenters who talked about solution journalism. And when you do solution journalism, I want to add something else, focusing on the responses, not just the problems. You know, we talk so much about the problems such that even a community can feel helpless, can feel, oh, there's nothing we can do about this. But when you focus on the responses and the solutions, then it becomes a little easier. Again, when you talk about solution journalism, you also want to think community-centered journalism, where you're talking about the community, amplifying their voices, highlighting their successes in overcoming some of these challenges. You also want to think about the local voices first, not just the local voices. Don't interview everybody in leadership, the elite, and everybody else, and the local voices come last. Start with the local voices. What have they done for themselves? What is it that can be done to improve what they have done? The innovation that they have adopted, how can it be supported, improved, amplified? You know, what is their perspective about an issue? How do they think a solution can come around? Start from the local voices. By the way, with this, you're going to get a lot of clicks, so that you now come out of that clickbait thing. You know, you're thinking, oh, if I don't interview the person in leadership, the governor, the minister, you know, the prime minister, I will not get very many clicks. I'll tell you this for sure. The minute you come with the local voices, people want to hear themselves. So they'll tell each other, and you begin to get those many clicks. And then also think about visuals. What photos will you use? And when you think about the photos, the infographics, the short videos, think the positive photos. Don't show them in their point of weakness. Show them in their point of overcoming. Let the point of weakness be just part of the narrative and not a very big part, small part of the narrative, so that we show the power that they have had as communities in overcoming the challenges. How do we build impact with these techniques? Leverage on social media for advocacy. Very important. On a day like today, most communities are on social media for receiving whatever information. I know you have your media house. Put that same content on social media. In fact, put it in your own WhatsApp groups. Let people know what you're talking about in the media. Put it in your Facebook page. Put it on Twitter, Instagram. You know, create a TikTok and a trend at that point because of something that you have highlighted. Partner with NGOs and activists and health workers. They'll give you the facts. They'll give you the data. They'll give you all the information that you need. Follow up on stories to maintain pressure on duty bearers. You see, when we highlight an issue about lack of sanitary facility suitable for girls in a school, if we talk about that in the month of February, in the month of September, we need to go back and check, did anything happen? If nothing happened, we do the story one more time. We must keep the pressure on until things change and make things better for our mothers and our sisters, even for our brothers. Because when we do not put these issues at the forefront and keep consistently reminding the duty bearers, they will ignore it. They will not allocate resources. They will promise and not keep the promise. If they make a promise, good, go to the promise. On such and such a day, so and so said this. On such and such a day, this is what is on the ground. That makes you an impactful journalist. Engage in cross-region collaborations for broader reach. Don't talk about only your small community, your country. What is happening in Kenya is likely happening in Tanzania, is likely happening in Zambia, is likely happening in Malawi, is likely happening in Rwanda. What stories can you borrow from there? What data and information can you borrow from there? Collaborate it together with yours, now make a rich story. By the way, those are the award-winning stories. Remember the stories that we've just been told? There are awards that have been announced. This is how you get those stories. This is how you get those stories. I want to read for you a little bit of what is written on that yellow sticker. This person is saying, what I liked best about the project was that real life stories were told about people who live in the community, the whole story, and not just the negative side of the story. The specific part in the process that stuck with me was how passionate. You see those ones that I have highlighted? Those are the things that stand out. Are you passionate about the subject that you're writing about? Everyone involved with the project is about changing the narrative of our city, changing the narrative of our women, our men, and so on. Moving through the story and beyond. If you tell impactful stories, people will remember them. People will remember you. People will celebrate you. So these are my closing words. Your pen, your camera, your microphone. Perhaps I should also add there your keyboard. They are the tools for justice. Use them very boldly. Do not fear. Commit to at least one follow-up story on a gender-related issue in your coverage area. Don't forget. When you do a story, don't throw it in the bin. When you do a story, put the next slide. When you do a story, remember, go back to it so that people can remember and take action. I want to say thank you very much for the time. Thank you so much for listening to me. And for those who have been sending the love hearts, here is to you. Thank you.
Thank you, Ms. Christine. Let's keep the conversation going and continue to be the voice for those who need it most. Thank you so much for joining in. Thank you so much. Have a nice day. See you next time.